So I have never seen a conversation with a physical therapist that favors therapeutic dry needling and Asian medicine, with a doctor of Asian medicine that also favors dry needling and Asian medicine. So I've never seen that or heard that conversation, much less be a part of one. And neither have you until now, where we're going to talk about this. And it's probably a conversation that Dr. Matt Tolstoy and I have had for a long time. And you're going to see this is very organic, because the truth is that there is high level of utility and high level of belief in the efficacy, in my opinion, of both therapeutic dry needling that is explained with Western science, that is primarily treating bone, muscle, and nerve, as well as all of the different components that seem to challenge the book, if you will, that governs how we help people. The last thing I'll say before I let Matt introduce himself is that part of this conversation, which is biased, is that both of us will have a very, very strong background and belief that all of those methods that are incredibly useful to help people should be funneled into some form of physiological fitness. I met Matt, what are we gonna say, 12, 13 years ago, in the second cohort of, at the time, that Equinox Tier 4 was putting trainers through. And I remember very, very clearly, because you remember things that are highly emotional, and emotional things you remember. I remember saying to him, and I don't remember where the context was, but when we would do those seminars, whenever there was a break, we would take as long as necessary to go over everything from beginning. It was NKT, that's what you were talking about, wasn't it?
Probably, yeah.
Hey, applied kinesiology does something, which is gonna be, that's why I'm saying it. I don't care what the name of the commercial model is. Applied kinesiology, it does something. Now, we could discuss and argue, and unfortunately, it might be an argument for a lot of situations where there's no winner. There doesn't have to be. If something happened, maybe it's not because why you thought it happened, but what matters is that it did happen. But that's what he was talking about. And I'm like, you're a trainer, like you're a personal trainer. You don't want to be a personal trainer if you're talking about that you're getting so excited about methods that have nothing to do with improving fitness. You might need them and use them to get to fitness. I say you don't want to be a trainer. Like, just go back, go to physical therapy school, go to chiropractic school. It probably wasn't on the tip of my tongue. And a few years later, we found out that he chose to go to Asian medicine school, which is just as good, because you're using methods that, when the fitness process is not completely warranted, you've got methods to get you there. And I'm entirely favorable when those methods are used in that context. I'm also going to say, no differently than you can't say that there's not aliens in the world, because you don't know that there are, you don't know that there aren't. So I'm not going to say that the things, that's just not how I believe things, when as in this case, as it relates to Asian medicine. So we don't know that it's not happening. What we do know is that if you do X, Y, Z, and somebody's shoulder moves more, or somebody's knee moves better, or because Asian medicine does have the legal warranty to treat all 10 systems of the body, if we can agree on how we measure those things, and we'll talk more about that as well as we talk about the differences and similarities between therapeutic dry needling and Asian acupuncture. Is that all fair? Is that all cool? All right, so riff off of that, Matt. Say whatever you want, but you know where we're going with some of these topics that we'll discuss here.
Yeah, absolutely. I think that the best starting point for this discussion is understanding that tools fit inside of a larger system. And that if you have no system and you just have a bunch of tools, whether that be therapeutic dry needling or an approach to acupuncture, we have a problem because we don't have something steering the ship outside of just the tool itself, but the tool itself was never designed to steer the ship. And so the cohesion here that I think is not served in a lot of conversations is understanding what is the backdrop behind somebody choosing an intervention like acupuncture or therapeutic dry needling. And that is the entire approach that we embody with this type of systematic.
Well, I think the challenge, to riff off of that, most of any, whether it's a complete system, a good system, not a good system, a system means that you're going to do it the same way every single time. And you're going to be as comprehensive as possible so you don't miss anything. And of course, you're always going to miss things, but the reason that the airplane pilot does the same things every single time, even though he may know that he shouldn't have to check that one, there's no way in the world that it's ever going to possibly malfunction, He checks it anyway so he doesn't miss it. So he doesn't have to go back and, man, I wish I missed that. So to me, that's what a system is. But at the end of the day, systems are meant to impact mini systems. So let's start to talk about, I talked about bone, muscle, and nerve, okay? And therapeutic dry needling, we can start to form a suggestion that it does something to muscle. It can also do something to nerve, so it moves the bones in a different way. That makes a lot of sense, I hope, at least to me it does, as to why you would treat somebody with a passive technique. So you can then change the system, even if just temporarily, so that you can then do something else to create the next step of adaptation. I don't know that if anybody puts a needle into somebody and there's this automatic change, I don't call that an adaptation. I don't know what the correct word is. Sometimes I've called it an adjustment, but I don't like adjustment because that word is somewhat owned by chiropractic. It's a very specific thing, except an adjustment actually is an adjustment, because if you do a little side glide, do a little rotation, and do a little fold, boom, and then your neck moves brilliantly, I still don't call that an adaptation because it's not gonna stick. So this made-up word of adjustment, if anybody knows a better one, then please tell us. You temporarily modulate the nervous system. I'm not sure that if I put a needle in the same place as you would, the Asian medicine storyline is going to say you're doing it for a different reason. Number one, is that correct? Explain what that different reason is, because I think that's where this lands. Because the truth is, I think, is that we could put a needle in the same place, and we could be doing it for the same systematic reason. I want this to happen. I'm gonna put a needle in one of the 3 trigger points in the infraspinatus. And I'm gonna confirm, because they're never the same in every single person. And I expect the person's arm to move better. And the reason it's gonna move better is because there's this cascade of events that happen at a very cellular level that equates to the tissue relaxing. That's what I think. That's what I think the energy crisis theory, which is very difficult to prove, that's why it's called a theory, would govern what I just described. So energy crisis theory, if you want to look that up. But we would probably both agree that somebody's arm moving better or moving more or with less pain is a desirable systematic goal. But again, that's what I think is happening. You could put it in the exact same place, but the Asian medicine story says otherwise. What is that story?
Sure. We would use different words, but I think that if you zoom out just a tiny bit, you can see the overlap completely. I think energy crisis is a great word to start with because, as many people are likely familiar, one of the major concepts of the descriptor terms in acupuncture is moving energies, moving qi through the body. And if you see that as, like many things are in the Asian medicine model, a metaphor for what is happening physiologically.
What is qi? What is energy? Because if even one person watches this and even takes a more benign view and a more, at least in my opinion, properly social view, because people don't have to believe the same things. We do have to agree on what works and doesn't work. Somebody's watching that says that's bullshit. What is it? Before we even say what our opinion on it. What is, because I don't know. I don't know what energy is. I know I've heard the word. People will say I talk with a lot of energy. Qi is again a word that maybe if you're familiar with martial arts, but what is it as a medical provider?
Sure.